Hi, I'm Eddie Patton, neurologist in Houston, Texas, and current board member of the Texas Neurological Society. I'm excited today to bring you this edition of The Business of Neurology. The Business of Neurology is a video series that's sponsored by the Texas Neurological Society to educate members on certain business aspects of the practice of neurology. Today, we have with us Dr. Stephen Vernino of UT Southwestern here in Dallas, Texas. We'll be talking specifically about a career in academic neurology. Now here's a little bit more information about Dr. Vernino. Dr. Stephen Vernino is a distinguished teaching professor and vice chair of education for faculty affairs at the Department of Neurology at UT Southwestern in Dallas, Texas. He specializes in neuromuscular diseases. He earned his medical degree and PhD from Baylor College of Medicine in Houston. He completed a neurology residency and fellowship training in neuroimmunology and electromyography at Mayo Clinic in Rochester, Minnesota, before joining the UT Southwestern faculty in 2004. Dr. Vernino holds the Dr. Bob and Jean Smith Foundation Distinguished Chair in Neuromuscular Disease Research and the Rex Griswold Distinguished Professorship in Multiple System Atrophy. He is the Director of Autonomic Disorders Program and MSA Multidisciplinary Clinic. His primary research goal has to do with improving the diagnosis and treatment of autonomic disorders. He has over 120 peer-reviewed articles and dozens of book chapters and reviews. He's won numerous awards as a clinician, researcher, and teacher, including the 1998 American Academy of Neurology Founders Award, the 2013 AAN Program Director Recognition Award, and the 2018 University of Texas Regents Outstanding Teacher Award. He was inducted into the Southwestern Academy of Teachers in 2015. Let's talk with Dr. Vernino about a career in academic neurology. Welcome to this edition of the Business of Neurology, where we're going to talk about academic neurology with Dr. Stephen Vernino here at UT Southwestern. Dr. Vernino, thank you so much for being here.
Thanks, Eddie. Great talking to you.
Absolutely. All right, so let's get right into it and talk about a topic that, when you talk about academic neurology, the first thing that a lot of people think about is salaries and some of the changes or differences in the salaries. So can you explain to the viewers why there's a difference in some of the salaries between academic physicians and private physicians?
Sure, yeah, and I'll start off by saying that the lines between academic and private practice neurology are somewhat blurred these days, but the traditional academic practice at a major medical center, university setting, oftentimes, as you said, the salaries will be a bit less for academic neurologists. And that's for a variety of factors. Obviously, it's financial. In a major academic center, there's often an association with a safety net public hospital. The payer mix is often different, so that the income to the institution, to the department, is somewhat less, and that can be reflected in the salaries. But I think the main rationale is that the job expectations are a bit different. Okay. In an academic center, one would be expected to see patients, obviously, but then there are other responsibilities, such as teaching medical students and residents, doing research, and the income from those sorts of activities tends to be less. So it's a matter of adjusting the income depending on what the job responsibilities are. But again, it's quite diverse. There are some academic neurologists who are compensated quite a lot because they spend a lot of their time in the hospital doing a lot of clinical work, and others that are relatively less because they have a major research component to their salary. So quite a large range, but as you said, mainly because of the finances of an academic center. We'll get into some of the other reasons the salaries can be a bit less.
And even though there are differences in the salaries, there are other ways that an academic neurologist can increase their net income over the year from consulting with pharmaceutical companies and so forth. So Can you talk a little bit about that, and how does this work into the contracting and negotiation process of joining an academic institution?
Right, so it's very important if you're joining an academic practice or considering joining as an academic faculty to really understand some of the rules and regulations that are unique to that particular institution. So for example, some institutions don't allow much in the way of consulting or outside employment, and others are quite liberal about that. So it's important to understand that. So what you're talking about is, if you're an academic neurologist, you often have a subspecialty interest, and you've got some national reputation for your particular area of expertise, and that leads to opportunities to work with drug companies or others in terms of providing your expertise in clinical trial design or in advice about how to bring new drugs to market. So these can be in the form of an ad board or formal consulting contracts. And again, those are maybe more available to academic neurologists as long as they're allowable by the institution. And there's always some parameters around that. Your chair or your department don't want that part of your work to become a major source of income relative to your base salary. Even beyond the sort of work with drug companies, there are other opportunities such as medical legal consulting, which of course also would be potentially available to private practice neurologists. That can be quite lucrative if that's something you're interested in. And then even within academic practices, much like private practice, there are various incentives. Obviously clinical productivity incentives are there, but in the academic world, sometimes departments will prioritize certain things, like getting a grant or publishing a paper, and there could be financial incentives associated with that as well. So again, very important as you're getting the lay of the land and deciding whether you want to enter into an academic practice as a faculty member, understand what's available and what the limitations are in terms of outside employment.
Absolutely, but there are opportunities for you in that.
Certainly, yeah.
Excellent. All right, so let's talk a little bit about the different academic neurology tracks and the expectations of like clinical versus the more traditional. You spoke a second ago about having to acquire grants and so forth, but I know some academic neurologists who do more clinic and focus more on the clinic. So I'd like for you to educate the viewers a little bit about that, and also some of the requirements, fellowship requirements. I know that most academic neurologists are fellowship trained, but not all. So
yeah.
A little bit more about
that.
that.
I think this is very important, and can be confusing because each institution, many institutions have different types of academic tracks. So as you join as a faculty member, it's very important to know what track are you on.
Okay.
And believe it or not, sometimes people are kind of unaware. So as you said, we'll start with the traditional, we call traditional tenure track faculty, which used to be 20, 30 years ago was the only type of academic track that there was. Typically, if you're on the tenure track, you may, as a clinician scientist, you'll see patients, but one of the big thrusts of your measurement of success is your ability to do high quality research. And that would be reflected in ability to get grants, publishing high quality papers, giving talks, this sort of thing. And typically, assistant professors on the tenure track are expected to show some signs of success in these areas within the first 7 to 8 years of their faculty position, meaning that they would get an independent grant, start their own lab, put out some high quality papers. And so that's appropriate for some people, particularly MD PhDs or people with a lot of science background who really want to have a laboratory and really invest the majority of their time in research pursuits with a relatively smaller clinical operation. So there's some challenges with that. Obviously, getting grants from the NIH isn't so easy. Yeah. But there's some advantages too, because on the tenure track, eventually you would achieve what's called tenure, which is sort of one of the things that academic faculty strive for. Tenure basically means that as a tenured professor or associate professor, that you can pursue your own research interests and discover things that may be unpopular, but you still have security in terms of your faculty appointment.
It sounds like job security.
Job security eventually, but some risk up front.
Okay.
So there are other tracks. As time has gone by, it was recognized that not every academic faculty member really fits into that mold, and we do need high quality clinicians who are experts in their field to be part of the academic faculty. And that gave rise to clinical tracks. In some institutions, there are just one clinical track. There's the tenure track and then a clinical track, or sometimes called the clinical service line. And those are faculty whose main expectation and reason for being on the faculty is clinical excellence, to provide clinical care, to be an expert in their field. And by extension, their measure of success is getting referrals and being known as an expert and giving talks on their particular field of expertise, and they would get promoted based on those accomplishments. But it was recognized that there are probably subtleties and in-between type of people. So particularly here at UT Southwestern, we have a clinician scholar track, which is somebody does essentially 50% clinical work and 50% research. There's a clinician educator track at many places where the faculty members expect to be a high quality clinician, but also invest a lot of their time in education. Okay. Not just in run-of-the-mill teaching medical students while they're on service, but really being innovative in their teaching, publishing about new teaching methods, developing teaching programs, and that sort of thing. And there can be other variations of these sorts of tracks. And then finally, what's come along somewhat recently is pure clinical tracks, where you're basically joining an academic faculty but are working mostly as a private practice neurologist, and your main job is seeing patients all day and measured really entirely on your productivity as you might be in a private practice. And many academic centers have used this as they buy up community practices and they staff those with neurologists. So these are faculty members in the neurology department, but they're on remote locations, so they really don't have the opportunity to do teaching, to do research. And so sometimes these are called associate faculty or adjunct faculty or the like. So again, the main message here is to understand the track system wherever you're going to be taking an academic job, what the requirements are for promotion from assistant to associate professor and so on, and then how your success would be measured.
And are you seeing any trends along that, meaning more going to clinical versus the more tenure, or are things staying pretty stable?
I think there was a big, over the past 10, 15 years, there's a big move toward more academic clinical faculty. And we can talk a bit more later in our discussion about how that's structured and how you can have a successful and rewarding career along those tracks. But I think it's rather stable now. Many academic centers maybe have 2/3 of their faculty on more of the clinical or clinician educator tracks, and then a smaller percent on the research or tenure track type of pathway.
Well, that's all great information, and to be honest with you, you've educated me a lot about the different tracks, because I really didn't know it was that many different opportunities for neurologists seeking a career in academic neurology. I want to talk about now, or ask you about burnout. Everyone knows about burnout. It's been a hot topic, particularly amongst both clinics, outpatient clinics, community clinics, as well as academic institutions. How would you describe, or how could you compare the quality of life by pursuing a career in academic neurology compared to private neurology? Do you have more free time? And are there any changes in burnout rates and so forth among the two? Right.
Yeah. So I should start by a disclaimer that I've been an academic neurologist my entire career.
Okay.
I am very interested in this topic, and certainly talk to a lot of young neurologists who are trying to make this decision that we're talking about here, academics versus practice. So burnout's a big deal, and neurologists are at risk for burnout probably as much or more than any other specialty. So in academic neurology, there are some things that tend to mitigate burnout. One is some flexibility and some diversity in the types of things that you do. So again, an academic neurologist will see patients and perhaps have a busy clinical practice, but there's also opportunities to teach, opportunities to do research. If those are things that you enjoy, you have this ability to divide your time between different pursuits. And that flexibility and that diversity of activities tends to mitigate burnout to some extent. But there's a two-edged sword. So the other side of that is that you have multiple responsibilities, and sometimes that can be stressful. You have a busy clinical practice. You want to excel at your teaching mission, so you got to invest some time in that. You want to get that paper written or that grant written, and there's only so many hours in the day. So this idea that time is short can be challenging. my personal experience in academics, the reason I'm still here is that the pros outweigh the cons. You know, you can see a need, you can see an interest, and you can pursue that. And I think that ability to kind of follow your dreams, to coin a phrase, is somewhat more easy to do in an academic practice, and could mitigate burnout. But I certainly wouldn't say that there are no that there's a big difference. I mean, I think that the demands are differently, the stresses are different, and obviously someone is going to do best in the setting that best serves them. And it's also true that there are differences in different institutions. So as you're looking for academic jobs, some may be highly focused on research, and if that stresses you out, and you're like, I'd rather see patients and not you have such demands on publishing papers, then that's not a job you probably want. Getting back to our initial early discussion about really know what you're getting into when you get started.
Absolutely. Well, let's stay there then with the pros and the cons of the academic medicine, because I'd be really interested to hear. You've had a very successful career and long career in academic medicine, academic neurology. So what are some of the pros of going into academic neurology?
Sure. So I mentioned one already, and that's the ability to sort of divide your time between different things. And again, my personality is I frankly get bored doing the same thing day after day. So having some different things to occupy my time and switching tasks and multitasking is appealing to me. It may not be appealing to all people. So that's one advantage. But I think overall there are two big advantages, I think, to academic medicine, academic neurology in particular. One is the teaching aspect. So you're not just seeing patients on your own and working on your own. Many times you have trainees with you. That could be medical students, residents from neurology, residents from other specialties, fellows who are in their subspecialty training, and a bunch of colleagues who are like-minded academic sorts. And so there's this sense of community in academics, which I think could be present in some larger practices, but is very palpable in an academic center. It's a team effort, and that goes even beyond neurology. So you have most academic practices are multidisciplinary, so you'll have friends who are cardiologists or gastroenterologists or neurosurgeons that you can share cases with and explore kinds of things. And so somebody who's very curious and wants to spend a bit more time with patients. The other advantage is that academic templates, in terms of the number of patients you see in a day, is somewhat less, and again gets back to why the salaries may be a bit less. So we don't drive toward as high of a work RVU and financial productivity. The reason being is we recognize there has to be time to see the patients and teach about those patients. There has to be time to think about those patients and perhaps think about new research opportunities and so on. So the pace can be, I'm not saying it's slow, but a bit slower. So you have time to think and time to spend with residents and students and so on. Which leads to the other advantage, which is that you have residents and you have fellows and you have medical students. So for example, when you're on hospital service and have a bunch of patients to see, you have time to teach. The residents sort of take care of all the orders and reviewing the test results and writing up a nice note summary that you can take a look at. So it makes your life a bit more efficient. And even if you're on call at night, typically you're at home and a resident is calling you and saying, this is going on, what should I do? And you're teaching and you're taking care of patients, but you're not rushing into the hospital to give TPA and try to find the MRI films and all that kind of stuff that can be the bane of a private practice doctor. And I would say that the amount of on-call is typically much less for academic neurologists. So as primarily an outpatient neurologist, I typically do 4 weeks where I cover the hospital service in a whole year.
Oh, wow. Okay.
Whereas I know, talking to some people are looking at private practice contracts, you're on call every third night or every fifth night or, every third week or something like that. So, and again, that's call where you may have to run into the hospital and take care of things as opposed to, take some calls from your fellow residents and so on. So I think that's a big issue. And then lastly, really the goal of an academic practice, the opportunity is there to really grow in an area of subspecialty expertise. And we'll talk about fellowships in just a minute, but I think to that end, it's expected that academic neurologists, especially those that are clinicians, would develop reputation and expertise in a specific area where you can actually become a content leader or content expert in the area that you're really interested in. So that's the ultimate goal. And if that's something that's appealing, then academic medicine may be right. Certainly that's possible as a private practice neurologist. I know many of them, over the course of time become well known as MS experts or stroke experts, and it takes a bit more time, but it can be done. And then, so that brings us to fellowship. So to that end, if you're planning to join an academic practice, you're probably going to subspecialize in a particular area. And subspecialization typically involves fellowship training. So there's a lot to learn in residency, and after 4 years, there's still a lot more to learn. And most academic neurologists will have done 1 or 2, sometimes 3 years of fellowship training, which can be a combination of additional clinical training, mentorship, and perhaps some research pursuits, depending on which track you're ultimately going to end up on.
Yeah. So it sounds like by doing those additional 1, 2, or 3 years of fellowship, it just opens up your opportunities, but also allows you to become more trained as an expert in that particular.
Right. And then as you go into your first faculty job as an academic with that fellowship experience, you're a little bit able to better negotiate and say, I'm a headache expert. I want to see headache patients. I don't want to see stroke patients. And generally that's the way it works, that there's enough neurologists who are subspecialized that people do what they love to do. They do what they're most expert in, and they're able to focus on those patients and then begin to build their expertise, their reputation, maybe even develop new programs in that area of expertise, which is kind of what we expect from academic neurologists.
No, that sounds like it decreases burnout as well. You're doing what you love.
Exactly, yeah.
It's good to hear. All right, we talked about the pros. Now let's hear some of the cons or negative things about going into academics.
Sure. So we touched on compensation or salary, which I think if you're committed to academic neurology, you can make a fine living doing that. And we talked about the reduction in call schedules and these sorts of things. So what comes with that? So basically, as we talked about before, you have some competing demands on your time as an academic neurologist. Certainly, your department will be monitoring your clinical productivity. You'll have some expectations for generating, either measured by work RVUs or numbers of patients or billing, whatever the metric is that the institution uses. So there's that demand. Academic practices tend to be busy. If you're the local expert in whatever, myasthenia gravis, you're probably going to get a lot of referrals, and you may not have the amount of space so access tends to be an issue. Whereas I think most private practice neurologists are always looking for more new patients.
That's right.
In academic neurology, we're like, let's try to triage and to take care of the patients that we can help with. The other disadvantage, I think, because of that, once you're recognized as a subspecialty area, is that your patients will tend to be more complex, sometimes more needy. They may have seen many neurologists before who weren't able to figure them out, and there may be a risk that you won't be able to figure them out either, which could lead to some dissatisfaction both for the patient and for yourself. And I hate to use the word dumping, but sometimes these patients at the private practice are really too complicated to be figured out in 30 minutes, and one knee-jerk reaction is to refer them to the academic center for higher level of care. So of course we, as academic neurologists, appreciate the challenge, but sometimes it can be frustrating. And then getting back to this sort of multiple demands. So here you are with a busy clinical practice, more patients to see than you have time for, but at the same time, there's this expectation that you're going to be a great teacher. And so you may be trying to get through a busy clinic day, and there's your resident next to you asking a lot of questions, and you want to spend the time to teach them, and that there can be some stress associated with that. But again, it takes a little planning to make sure that resident or fellow or medical student is also contributing to your efficiency. It's a tough balance. And then finally, in the academic world, there's an old saying, publish or perish. And that gets back to this idea that many academic institutions do value, even if you're on the clinician track, value publications and grant income and so on. So, and again, you need to know what those expectations are, and maybe they're fairly small. Maybe your department chair says you ought to publish a paper every other year at the minimum. It's not that much, but still there's that extra thing in the back of your head saying, I'm really busy seeing patients, I'm tired at the end of the day, oh, I need to write that paper. I've been meaning to write that paper. Or I've got a resident that wants to meet with me about a research project and I don't have time to do that. So there's a bit of, you have to make time for things that you love to do and make that be a positive and not a negative. But what I hear from some younger early career faculty who come and say, I tried the academic thing, it's not working out, it's usually that strain from multiple demands. I just don't feel like I'm good in all these areas, and I don't like not being good at all these areas, or my teaching suffering because I have these other demands, or I'm not able to get that paper done, or I feel like my patients are too complicated and I'm not doing a good job with that. So it's helpful to have a good mentor. It's helpful to set priorities, to really understand what your expectations are, and make sure that the expectations of academic neurology align with your own internal goals and expectations. Otherwise, you won't be happy.
Absolutely. Well, Dr. Vernino, this has been a great interview. I really appreciate all of the bits of knowledge that you've dropped. Do you have any other pearls of wisdom that you want to discuss with those watching, those who are considering either transferring over to academic neurology, or those coming out of training looking to pursue a career in academic neurology?
Yeah, I'll make one last point as you're planning a career, or if you're thinking about a change, and that is that it is possible to change trajectories, to move from private practice to academics, or vice versa.
Sure.
Probably the transition from academics into private practice is a bit easier, but the other direction is not impossible. We've had a number of very outstanding private practice neurologists from the community who happen to be great teachers and join our faculty, and with their knowledge, years of knowledge of taking care of lots of different patients, end up being really valuable to the academic mission and teaching. And I think we've touched on it a few times. The other bit of advice is to really understand what you're getting into, get some mentorship, really take some reflection and say, what do I really want to accomplish in my career? I think many people are in their residency or in their fellowship training are surrounded by academic neurologists, and they think, I want to be like that. I want to teach. I want to do research, but really don't understand what all goes into that. So having your eyes open, really understanding what the demands are of either track, either direction, is super important, and not to be sort of on the one-track mind of saying, I got to make a lot of money, I got a lot of debts, I got to take whoever's going to offer me the most money. I've seen a lot of very bright people who could succeed in academic neurology who take the big private practice offer and then discover, well, actually to make that big salary, I've got to do all this call and I've got to meet these RVU targets that are pretty demanding, and may have some buyer's remorse even in that direction. So,
Absolutely.
So as we were talking about the benefits of academic neurology, one other point is that there's some administrative support that's more robust in an academic setting. So I've have not had to spend my time worrying about how the clinic manager gets paid, or how the scheduling office hires new people. And I know in some private practices, as a physician, we have to get very involved with the business side of things, and that can be an additional stressor. So one advantage of academic medicine is typically there's an infrastructure for the billing, the scheduling, the vacation, trip time, and all those things that you want to not really have to worry about on a day-to-day basis.
Yeah, and I'm glad you brought that up because, of course, in looking at all of the articles that have been written and so forth about what's really decreasing the physician's quality of life, that high administrative burden is big, and it is real in private practice, and certainly, academic setting, you do have a lot more oversight, more team members to help you. So
and obviously there's some well-run big private groups that have staff that can do these sorts of things and do it well. But that's those aren't all that common, and even if you do have that, it's the physician partners who have to oversee all of that business too.
Excellent. Well, Dr. Venino, again, thank you so much for taking time out and doing this interview. This has been great. I've learned so much about academic neurology, and I think our viewers have gotten a lot of knowledge about if they're considering a career transition to academic neurology or coming out of training, pursuing a career in academic neurology. So
Yeah, my
thank
pleasure.
you so
Good to
much.
see you.
Absolutely. And thank you for joining us for this edition of the Business of Neurology. Please tune in to the Texas Neurological Site website for this edition and other editions of this video series.